and welcome to Check 12, where we talk to survivors, advocates and supporters of testicular cancer awareness here at the world famous podcast studio Glasgow. Jonny's story is one of resilience, strength and inspiration. We'll be discussing his battle with testicular cancer and how he navigated treatment and surgery and what life looks like on the other side of that. Whether you're tuning in as a survivor or a supporter or just someone looking to learn more, this episode is one you won't want to miss. Ladies and gentlemen, Jonny King. The question I was going to ask, now how you're saying like 5 months ago you were bald, was your hair always curly?
Yes, it was curly.
It was curly, yeah.
I think it's grown back slightly darker,
right.
But I've still got the curls, which is because you have to wait a while for the curl to start forming in your hair. Yeah. But yeah, it always was curly, and I'm glad that I've retained those curls. Yeah.
Because mine's came in like my hair's like poker straight. So when I had long hair, it was like straight. You didn't have to do anything to it. But when my hair grew back in, it grew in curly.
Right.
And then I think it was about 6 months, a year, and it was after that first haircut, all my curls went, and I was actually devastated because I've got this great picture. And I'm like, oh, happy that I've got curly hair. Yeah,
they say it comes back curlier, then it will normalise after a while. But yeah, it's interesting. I find the science of that really interesting.
Yeah. I know it's like why that happens, and you know, it's with the hair follicles and all that. It's almost like baby hair, essentially, because it's regrown, isn't it?
Yeah. Well, when my hair started to come through, it felt so soft, and I thought, well, it's new hair. It's never been cut before, and it is so soft. And you almost, when you have your first haircut, you think, oh, I don't want to get rid of this because it's nice and soft. But yeah, the science of it all really interests me, and my background's in biochemistry anyway. So throughout all of this, I've always been like, oh, but why does this happen? Oh, I know how this works. Or, my consultant would say to me, so what do you know about your disease already? And I'd say to them, I'd ramble on about all the science. Like, oh, right, have you read up about this? I was like, no, I've just got a degree in biochemistry. It's like, oh, okay. So that's always an interesting conversation between me and her.
I suppose we'll kind of come back to do the introduction, but that's a really the question I want to ask though is that with that, did you feel that sometimes they would underestimate like what you needed to know from them because you had a knowledge base already as well? Because I found it working in even though I was a nursing assistant, they'd say, oh, well, you'll know about this. And it's like, yeah, but go and still tell me anyway. Did you ever come across that?
I didn't actually. I felt like sometimes I was almost reminding them about things as well. Like they'd say, all right, you've already taken this anti-sickness tablet. It's like, no, actually, I don't take that on Thursdays, or that's not the day when this is taken, or you need to change my cannula because they haven't done it themselves. So, maybe not with the consultants that I've had, but if it's busy, then I guess I can sometimes maybe just I'm always making sure that I'm aware of what's happening to me. So even if they're like, oh, this is just your blah blah blah, it's like, oh no, actually I don't have that today, or something like that.
You're kind of you're more on top of it.
It's like an audit, I guess. Yeah.
Love it.
Yeah.
So thank you so much for coming on Check 12.
No, thank you very much.
If you just want to kind of introduce yourself, talk a little about your testicular cancer journey, and then we can just kind of go from there and have a chat.
Sure. So my name's Jonny. I'm 26 now, and in December last year, I was diagnosed with a testicular tumour. It was revealed later as stage 2 mixed non-seminomatous germ cell tumour. I've had myocardectomy. I've had 3 cycles of BEP chemo and open RPLND, and happy to say now I'm 6 months in remission.
And how do you feel physically now after all that? There's obviously going to be a mental toll of that, but physically, you feeling that you're kind of...
Physically now, I feel pretty good. It's taken a while because, we can talk about the mental aspects later, but physically, it took me a long time to recover from the RPLND. The orchidectomy, I was back on my feet within an hour of the operation, and I was kind of walking upstairs and things like that. And the chemotherapy, I did tolerate quite well, all things considered. By the end of my 3rd cycle, I was tired, but I was still having walks, for example, around the house or around nearby my house. But the RPLND, I had that only 5 or 6 weeks after my chemotherapy. So whilst my body was still physically recovering from the chemotherapy, it then had the trauma of major open surgery. So that my body kind of went through it, and I almost thought, kind of, how much more can my body take? So that recovery, which was about 6 weeks, before I started feeling kind of confident, even just standing up straight and not having a hunch, or being able to sleep on my side, or in the shower, like letting the sponge go over my scar. That took a lot of getting used to. But now I'm in a good place. I'm back at the gym, and I don't feel like it's stopping me from doing anything now. So although those feelings when you're in the moment are rubbish, you do get through it, and you look back on that now and think, gosh, look how far I've come, look how far my body has come, and that makes you feel good physically.
It's a little bit empowering in that way.
Definitely.
Yeah. Could you, with your kind of understanding of what you went through in your surgery, and you're quite confident at speaking about, if anybody who doesn't know what the RPLND is, would you be able to kind of just touch on what that is for people?
Sure. So essentially, RPLND is a fancy term. It stands for retroperitoneal lymph node dissection. So if we break that down, when you have, in most cancers, they're the first place they'll spread after their primary site is to lymph nodes. And the lymph nodes that are the next site after the testicles are what's called your retroperitoneal lymph nodes. And they sit just behind your tummy, behind your abdomen. And normally with testicular cancer, that will be the next place that they spread to. And usually, depending on the different cell types that make up your tumour, the chemotherapy can also, if they've already spread there, the chemotherapy often does a very good job of getting rid of all the nasty stuff that's taken up residence in those lymph nodes. And in the UK, once you've had your chemotherapy, you'll have a post-treatment CT scan or MRI scan, and if they have shrunk, which they did with me, they sometimes don't shrink fully. It can take a while for them to fully go back to normal, because there can either be cell debris, like just the cells are dead, but they're still there, just kind of lingering, for example, waiting to be cleared away. Or sometimes, as far as I understand it, some of the cell types, the life cycle of them can be, they've like aged the life cycle. So one of the cell types in my original tumour was teratoma, and when it's mature, when it's an old cell, it's not malignant. However, when it's a new cell, it acts like a stem cell, which has lots of these cells that are stem cells have a lot of opportunity to become loads of different types of cells. So they're often classed as more malignant because they are there's lots of biochemistry going on in those cells. Now, sometimes, as was the case with me, my lymph nodes were lower in the low density after my scan, and they weren't sure why they were persisting, and they looked a bit cystic, which means they looked a bit lumpy. And the only way to know for definite what's causing that is to remove them. So the scans can give you an idea, but you have to take them out and perform a histology on them, like you always have with your orchidectomy. Now, this procedure is quite taxing. So retroperitoneal means that's where they are, behind your tummy, lymph nodes, and then dissection is stripping all of these lymph nodes away from your body. Surgically demanding procedure. They can perform it through the keyhole process, but usually post-chemo, if you have quite a bit of scarring, they will often opt for the open procedure. So I have a 12-inch incision down my tummy from the bottom of my chest to the top of my pelvis. They access it through the tummy. So although it sits kind of near your spine and by your aorta and major blood vessels that go to and from your heart, they access it through the tummy. So once they've opened you up, they have to cut the muscle, they have to move your bowel out of the way, kind of move your kidneys out the way if they're in the way too. And then what the surgeon would then see is your major blood vessels and these lymph nodes, which are kind of attached to them like a net. And then the job there is to remove all of these lymph nodes and strip them off these vessels, and then kind of make sure everything's kind of put back together as it was, and then they will sew you up. So quite a surgically demanding procedure. Only a few urologists can perform this. So I was referred up to the Royal Marsden for that procedure, and I had that in May.
It's quite incredible the fact that they're able to do that anyway, but for your body to have went through that as well, it's quite something else. I think you look at lots of surgeries and that's as big as they get, really. You know, there's lots of like, other things, but to have that weighing on you beforehand, like, and obviously you having a really good sense of what's getting done, and obviously you like research and things like that has always been something that you've done anyway. How did you feel knowing that was the surgery you were going in for? Was it were you scared or nervous going into that?
I was terrified. I felt like I was on borrowed time a bit, because it's such a major procedure. I did trust all the professionals, and I knew that they would do a good job. But the thought of having to be under, again, a general anaesthetic, such a taxing procedure, because the orchidectomy isn't kind of, that's an outpatient procedure. You're kind of home the same day. And I'd had a small procedure done when I was a little boy, and that was just removing a lump as well. But this abdomen surgery felt so extreme, and it's such the area of your body is such a vulnerable area of your body, right by your aorta. You know, if that gets damaged, then that can cause issues in its own right.
Yeah.
So I was really scared, really, really scared. And by this point, at each point of my journey, I was told, you'll only need your orchidectomy, or you'll only need one cycle of chemo, or after the chemo, you won't need any more surgical interventions after your chemotherapy. And then being told that could benefit me, I thought, I have to kind of realign myself to the idea that I've got to have more treatment. And this is only from, you know, a tiny lump in my testicle having to cause so much torment in my head and trauma to my body, having to juggle that with just coming to terms with the fact that you have cancer anyway, because everyone has operations, whether it's cancer or not. But to kind of combine those two together is terrifying at 25, and you feel so vulnerable, and you have to ask, you kind of can't help but ask yourself, why is this happening to me? What have I done to deserve this? And you just have to tell yourself, like, this is going to get me better, and this is an investment in my health. Not everyone has to go through this, but I'm going to come through this stronger than I was before. And it's these kinds of experiences that tell us, you know, this is how strong you are, this is how resilient you are. And having gone through all of this, you know, I'm never going to stress about missing the bus or having a bad day at work. You know, I think, well, yeah, that might have happened, but I've gone through such a traumatic experience that I've survived, and that's what keeps me going, I think.
Yeah.
So, but yeah, it has been tough, but I guess I'm still recovering from it a bit. But it's a continuous journey. Yeah,
which is a healthy way to look at it anyway, even at this early stage of your recovery as well. So, you know, kudos for that. Thank you. I think that's I know I didn't go through the biggest surgery, but I understand the kind of going under the general anaesthetic, and having not been used to that, you know, it's terrified me, because I was much like yourself. I had a procedure done when I was younger. I had a hydrocele when I was, I think I was about 4, and it's one of my core memories, because I can even remember the boxer shorts I had on. I was like these little froggy boxer shorts. So it's when it's ingrained like that, you do have that fear of these types of big operations. But how did you find your testicular lump, and what led you to kind of find your cancer?
Yeah, so it was November last year. I was in Manchester, and I was getting ready for a night out, and I felt a lump there as I was getting changed. And I remembered that about a week previously, I had a bit of pain in my lower pelvis, so kind of where your groin is, and that same testicle had kind of migrated a little bit up into when it's cold and your testicles go in. That happened only to that testicle, and I thought, that's a bit weird. But it wasn't painful. If I touched it, it would become painful. But I just left it, and then by the next day it was normal again. But I hadn't examined it. So a week later, I then found the lump getting changed in Manchester, and I thought, gosh, I'm just about to go out and enjoy myself. So I kind of had to compartmentalise my brain and thought, right, I'm just going to enjoy my night. When I'm back home, I'll look into it. Yeah. So that's what kind of kicked off all of that process.
And then you just went down the spiral of, you know, going to the doctors and.
Yeah, so I rang up. I did couldn't get a GP appointment, so I just did an online form, which they have there, and they called me, I think, the next day and said, I'm going to send you for an ultrasound, an urgent ultrasound of your testicle, because I did put on the form. I'm not sure if it's just an inflammation of my epididymis, the tubes that go from your testicle, kind of expecting them to just do that. They'll just rule it out there and then. And then 2 weeks later, I had my ultrasound, and they said, I'm going to send a report back to your GP. And he said, yeah, because it does look a bit suspicious. So I thought, oh goodness, that's something to comprehend, on top of, I was changing jobs at the time too. So this was on a Friday, and then on the Monday I started my new job. And that's when my GP rang me and said, yeah, we need to put you on a 2-week suspected cancer pathway for testicular cancer. And hearing that on your first day is as if the first day isn't a new chapter in its own right, in a good way. It kind of has to happen in parallel with something that can be so daunting. And at the same time, I saw the radiology report on my ultrasound. It said, there's a suspicious lesion on the right testicle, and reading that, I can picture that black and white that day when I was just reading it, and it kind of definitely got the ball rolling with everything that was on its way. So I then got referred to a urologist, and they said, the only way really to know this for sure is to perform an orchidectomy, and I knew a bit about that anyway. So at this point, I was like, right, well, let's just get it out. I don't want to be. I'd have had it there if I could in that clinic room. But that was booked, I think, 2 weeks later, exactly 2 weeks later, and I was feeling quite empowered because I thought, right, well, I've taken charge of my health, and everything's moving along as it should be. So I felt in control. And again, I think my brain had still compartmentalized a bit because I thought I need to enjoy my new job. I need to kind of recognize that I'm in a good place here. I'm in a good place with my social life, with my family, and we'll worry about that when I need to worry about it. And the day came for my orchidectomy, and I was nervous because it's a procedure, but I knew it was fairly straightforward. I knew I'd be home the same day. And the day came, and met my surgeon, and before I knew it, I was kind of up again. And I woke up from that procedure because I went to bed quite chilled, thinking this is going to sort me out. So I woke up and felt the same. They say that you feel as you felt when you fell asleep when you wake up. So I felt pretty good. And as I say, I was home the same day and was able to celebrate Christmas, and that was great too. And I mean, coming to terms with losing a testicle, it didn't affect me that much. I thought, well, I see myself as quite progressive. I don't let the fact, I don't see the male identity as someone who has to have 2 testicles. That's not the way I see things. So to have lost a testicle, I thought, well, that's a battle wound from a war that I'm hopefully going to win. So I felt really empowered to just have 1 testicle. And it can, in most cases, and certainly in mine, it's done all the compensation in terms of the hormones and kind of, all my testosterone levels are all fine. And so, I'm very thankful to my left testicle now. Maybe not my right one, but yeah, that's been a relief. And that was kind of the story of finding the lump and then getting it removed. Yeah.
And there is a lot of that as well. I would find in the conversations that we're having on here, there is guys who, when they're in a younger age, will feel that, that my masculinity is tied to my genitals. They'll feel that, if it's my balls, my bollocks, whatever they're calling them, that's how you be a man, But then you've had guys like myself who, I was a bit like you, I didn't tie my masculinity to there. So when it wasn't a big deal losing one at the time, I think you could get the psychologist in and they'd unpick all of what I'm just saying to you. But but at the time I was like, no, just get it out. I didn't opt for the prosthetic and all that type of thing because I was quite happy at just being what it is, and now at the point, like you're saying, I'm quite thankful that my remaining ones still try to, do what it does. I don't call it my right or left now; it's just my middle testicle.
Yeah, that's a good. Yeah, I've not thought of that. It's a good one.
It's like, and you can feel it when you jump on something. You go, oh, wait a minute.
Yeah, yeah.
But it's nice to hear that though. That being so young and going through all that, but that was your overarching idea of your orchidectomy, was that it was let's just get this done. How was, after you've had that surgery, within your peer group and your social groups and all that, and having that that happen to you, what was the support like within that? How was your support networks within that as well?
So in the weeks leading up to the orchidectomy, I did a post on my Instagram saying, check your testicles, it's really important. It's it can easily be sorted. And I was probably quite vulnerable there. I was showing a lot of vulnerability, saying that I've found a lump in my testicle, because a lot of people my age, they'll only be posting on when they go on nights out or whatever. And that's what I had done previously as well. So if you look at my Insta feed, it suddenly goes from me taking pictures of myself on nights out to suddenly check your testes, or this is how I look like after I've had an operation. There was a lot of support at the beginning because I think it struck a chord with a lot of people, and I had a lot of people round me, I would say. People who I've not spoken to in a long time. Obviously, my family have been amazing throughout the whole process. But yeah, my friends were there a lot at the beginning. And I think over time, I guess they get... I can only describe it as like support fatigue, because as it's gone on, I've not got the same level of support. And I think that's mostly tied to not having the same understanding, because I understand my experience loads. Not everyone else will, no matter how much I document it. And I have been very kind of explicit on Instagram about my experiences. And I think, I've not had, when it started in December, my treatment, the support was all the way up there. And I think by the time I was home from my RPLND in May, I think the support had dwindled, to be honest with you. And I put it down to not having the right awareness. Some people living in, they have their own problems, they have their own challenges in life, and not everyone has, I guess, I'm a very empathetic person, and I think I can't expect everyone else to have the same empathy as me. And also, this whole experience has aged me. I think I'm more mature now than I was at the beginning. And obviously, people who haven't had that experience, they're still where they are, being 25, 26, or even in their 30s. And they've had a different walk of life. So everyone's life shapes their own outlook on supporting other people. So I've had to accept that, I've not necessarily got the same friends that I did have previously, but I'm my own friend now in a way, and I know the people that have been there for me, and I value that loads. And I've had strangers come up to me and say, if I follow you on Twitter or I follow you on Instagram, or people that I used to speak to have messaged me, and it's really great what you're doing. And so it's just I think it's a part of life, really, in terms of support. It just changes over time.
Yeah, and I can understand that as well. And I think the more that you invest in that awareness or education around testicular cancer, because it's happened to you, because everybody, you're right, everybody will have their own things going on, and then they might be focusing on something that's happening with them, but I think it's still such a taboo thing as well. I think when it comes to testicular cancer, they'll have the support there for you, but the ones who are closest to you will maintain that, but those kind of satellite friends almost will be the ones who will disappear, because they'll be like, I can't be worth listening to that anymore. And it's like, but when you become so passionate about something, especially when it's happened to you, and I think social media, and you look at your social media, and it can have such a huge impact, because it just takes one person to type in to the search like testicular cancer or whatever, and then they happen upon you, and they go, oh, there's somebody who gets it, or somebody you could have helped somebody find a lump that you don't know, but they've done it because you've been so open.
Yeah.
And has that ever been like a thought at the back of your head when you've been doing this? Is it, are you kind of so on top of that awareness because you want to help people in that way as well?
In terms of being so public, I've done it to primarily help myself, because it feels more normal to me when I'm kind of posting about it as if it's like a trip out, or so I would put a picture of my chemotherapy bag and it would be "To Toxic" by Britney Spears or something, and that would just put a bit of humor in it, and that would help me. My other friends, people who follow me would find it funny, but equally, almost incidentally, people have come up to me and said, thank you for doing what you're doing, because it makes such a difference. And because testicular cancer does primarily affect younger people, I think it's good to have people doing these kinds of things, because you look at kind of other cancers and there's you have loads of other kind of initiatives going on. And I think doing what I can from my little following and kind of raising awareness from that, I think it's great. And I'm really happy that people have benefited from it. And I think as time's gone on, I guess, now sometimes I do it more for other people to a degree as well. I mean, I had, alongside all my treatment, I had counselling, and I put a thing up when I finished my counselling saying, this has really helped me, but it can help anyone, irrespective of whether you have a disease, whether you have cancer or not. I think it's just really good anyway. So even just, I do that to advocate for everyone, to kind of, there's benefits of this to everyone. So, I probably do it a little bit more now for other people as well. But that intrinsically benefits me too, because it makes me feel like I'm doing something good.
Yeah. Have you because you are quite public with it, and there is this horrible toxic side of social media. Have you came across negative interactions while you're posting things, or is it always just all positive for you? I
don't think so. I think sometimes I might have interpreted things negatively because of my own mental health throughout all of this. People might say, oh, well, at least it's not stage 3 cancer, and I think, what's that supposed to mean? Or, oh, I've recently had a diagnosis too, and then they'll tell me what it is, and it's nothing to do with cancer, or and I think, how does that help me? It's a completely different thing. Equally, I've become friends with people who have had testicular cancer, and then they've just drifted away because they've had their own issues with their own kind of with making sense of it all, and that's kind of driven us apart because they've got their own challenges in their own circumstances. So I think sometimes I might have interpreted things not in the way that they were meant, but that goes hand in hand with the mental struggles, I think, that comes along with having to have chemotherapy and the RPLND, because for so long I thought that I only needed the orchidectomy. My first CT scan was clear, so I thought at most I'd need one cycle of chemotherapy as a preventative, not as a curative regime. And I think when I got my call that said your HCG is even higher post orchidectomy, that was bigger. That was a bigger shock to me than being told that I had a lump in my testicle in the first place.
Right.
Because I remember clear as day. I was sitting in my lounge on my sofa, and my consultant was on the phone, who I'd just met for the first time the day before, and she said, "Yeah, your HCG's rising rapidly. We need to do another CT and book you in for chemo." And that was the biggest bit of dread and worry for me. And I think there's less when you publish that, which I did. I posted on Instagram about that, and I think there was almost not the same support there, because I think, oh, Jonny's posted again about testicular cancer, or, oh, it's gotten worse for Jonny. And it's almost like it's just support fatigue, I would call it. And that was tricky too, because during the chemo as well, I feel like the support waned. And by the time chemotherapy had ended and I felt really good because my tumours had normalised, people think, oh, well, Jonny's fine now, the treatment's ended. And it just doesn't work like that.
No.
And I felt like I wanted to educate people more, but I felt like I might have come across a bit aggressive and thought it doesn't work like that. It's not like you take an antibiotic and you're fine. I've got, it changes you. And I came out of chemo bald. I came out of it, anemic, and you can't say you're all right now, because look at you. You've lost weight, you've lost muscle, and I felt so not myself, even though it had done what it had done. And the chemotherapy is great because it has. The cure rate of testicular cancer's improved massively because of chemotherapy.
Yeah.
But you come away feeling like you've been through a war zone. And I think for people to just think, oh, you've had your medicine, you're all better now, and it just doesn't work like that.
Yeah, I think because there can be such a quick turnaround in terms of how you look. You know, you can go from like being, but then it's not quite. You know, it's not. You're not on years and years worth of chemo, and I think growing up, I've spoken about this before, where I knew one cancer patient, and it was a kid who I went to school with who had leukemia,
Right.
and it was a very different experience chemo wise for him. And that was my only starting point of what it could be like, and it wasn't like that for me. I mean, chemo was rough. Don't get me wrong, but the mental gymnastics that you must have had to do from going like it's this, and then it's for me, I was. This is going to happen, and it was A to B.
Yeah.
Like, so I knew that I was getting my testicle out, and then I was going to get chemotherapy. You know, and the talk of the kind of lymph nodes was pretty much done and dusted right away because of the CT scan that got done. So they were pretty sure that, you know, and I had to get the 2 rounds because it looked like it was creeping up, but I was quite lucky in that respect. But you were told this, then it changed, you know. How was that being 25 mentally, you know, you've touched on it already, but to kind of expand on it, you know, that must have been horrific to kind of keep going for one thing that was just like, no, it's more.
Yeah, it was really tough because I think the first time when I realised I had to go, it wasn't A to B in that I needed 3 rounds of chemo. The month previous to that, so January, so I was recovered from my orchidectomy. I felt absolutely fine. I felt great. And yet, unbeknownst to me, my lymph nodes in what we spoke about earlier, they were just growing and growing. My HCG was rising. And yeah, I felt fine. So to be told, no, you're not fine because of your CT scan and your bloods and needing the chemo, that was, like I said, that was a big shock. And yeah, I had to really come to terms with that, and I was just exhausted. I was tired all the time because of the anxiety and the fear. I was mentally drained. I was physically drained. I didn't want to do anything. It was a miracle that I was able to sleep and eat, I think, because it tormented me a bit, having to go to bed thinking, right, I'm going to bed all the while my HCG is going to keep going up, or you know, it's just going to become more and more malignant. Luckily, I did start chemo very soon after that, even though those days in between feel like years. And that was tough. And kind of even by the time I was on my last cycle of chemo, my hands, you know, my veins were just broken, and I felt I'd cry when a cannula wouldn't go in. If my pulse was relatively raised, I think, oh God, they're not going to give me my treatment. I'm not going to get better. Being around so many other people in the chemotherapy room that aren't my age, that are going through a different cancer, and they've got a different regime. You know, it was tough to deal with all of that. Feeling sick all the time. I luckily wasn't sick, but having to deal with all of that. And then after the chemo, you think, yes, the chemo's ended, and then you have your post-chemo CT scan, and they're like, wait, so we're going to refer you to a urologist in the Royal Marsden, where I went for my RPLND surgery. And it was almost like it was proposed to me first as it's worth considering this, so we'll send you up there to your surgeon. And then by the time I meet them and they say, right, this is what I'm going to be doing, this is how long you're going to be in hospital. And I thought, right, so it's definitely happening then. And I just thought, by that point, I'd already had one kind of, I'd had to go from A to B to C with the chemo, and now to D with the RPLND. That was the big, oh, when will this ever end? Like, will I need a lobectomy? Will I need a head scan? And that was really scary, because I thought, when will it end? Because I've already had this once. Now I've got to have it again. When does it end? Yeah. So I remember in the weeks leading up to the surgery at the Royal Marsden, and just thinking, gosh, you know, will they get everything they need? Will there be any complications? And it was a mental war zone. I mean, luckily, I'm absolutely fine now, and the lymph nodes they removed, they were pre-cancerous, basically. It was mature teratoma, so they were right to operate. And we wouldn't have known that unless they did operate. So it's a gamble, and it's horrible to gamble yourself like that in a way. But they were right to do it, and I was right to go through it. And that's what reminds me that it's everything I've done has been an investment in my health. And I'm starting to like my scar more and more now. Yeah. And again, it's like a battle scar from a war that I've won. So although I have my fears about every time I have to have my bloods done in the first year every 2 months, I worry about that. And I always think, oh gosh, what if the HCG goes up? But it's undetectable in my blood, and I feel like, because I feel fine now, although I felt fine in January, because I feel fine and I look fine, I tend to believe I probably am fine. So it's having to deal with the uncertainty sometimes, but yeah, it's been a war zone, but like I said earlier, I think that's what's informed the resilience that I have now.
Yeah, and I think that's a great thing to be able to kind of have that positive mental attitude to do that. I know as time goes on, and for me, next year I'm going to be 10 years since, so it'll be, but there is times where you kind of go, I look fine, I feel fine. But then there's just that little odd thing. So recently, I found a lump in my remaining testicle, and I was devastated. I was like, "Oh no, we're going to go through all this again." Knowing pretty much that it was on my epididymis, but not really allowing myself to kind of go the whole route. But then having that fear of going back under the knife, and it's scary in itself, because you just don't know. And even nearly 10 years out, you still have that, informed trauma that will make you feel that, no, this isn't right. And it knocks every bit of common sense that you have. If I was talking to you and you were saying the same thing to me, I'd be like, Jonny, it's fine. It's just going to be this, this, and this. But your brain doesn't allow you to do that. And I suppose, being within a short space of time since like that year for you, mentally, how have you felt the changes for you? Obviously you're saying that you felt you've matured through it, because I suppose you've had literally a near-death experience, and I think that's what people have to remember. And I think that's what the people who are around you might not realise as well, that they talk about testicular cancer and the high success rate of its curability, but everything that you went through is a near-death experience. And how does that affect you now, and how do you cope with that as a young person still, going through such a traumatic event?
So it has been difficult, and at times I've thought, right, I want my other testicle out, because that way it removes the possibility of testicular cancer altogether. I've thought, because I'll get a dull ache in my testicle and I think, what's that? But then everyone gets aches and pains. My big toe will ache and I think, what's that? Or my chest will ache. And it's really difficult sometimes to rationalise that. But you have to remember, I had all of these aches before I had cancer. So how do I rationalise that? I guess I just acknowledge it and I try my best to move on. So I try and distract myself or invest my thoughts in something better, more fun, like enjoying my life or doing something else with work or my friends or my family. It is really difficult though. And, I've had scanxiety when I've had, when I've had follow-up CT scans, I've thought, what on earth are they going to find? Every time I have my bloods done, I worry too. I don't know how you could make that better. I like to think time is a good healer, but you're right. It does change you, and it's part of my life. I have to acknowledge that and accept it, and in some ways embrace it, because otherwise you're only thinking, well, that's that. Yes, it was part of your life previously, but it has to inform you now. And I think being aware of it, being aware that there's uncertainties in everything in life, is kind of helps ground me a bit. Yes, my cancer could come back, but yes, there could be a tornado tomorrow and that could kill me too. So, I guess it might not be the most productive way of thinking, but it helps me rationalise it a bit, knowing that there's uncertainty in everything, and that shouldn't stop you living your life, because it just shouldn't.
Yeah, no, I think you're right. I think that's the thing you try and do the most is, rationalise it as best you can. I think for me, it was always just, see, doing this job, I always thought, like, when I came into, like working for Cahonas, I was like, maybe I've made the wrong thing, because you're talking about cancer constantly, and we talked off camera, about, maybe watching somebody talking about it can be triggering if you've went through it. I know certainly for me though, it's helped a whole lot in terms of coming to terms with the fact that I've had cancer, because I think, and it's actually allowed me to kind of embrace that a little bit more, because for years I would never say I was a survivor. I think again because of the stigma around testicular cancer, and you do get people, oh, it was just testicular cancer, and whereas when you go back and you look through each part of your journey, each part of the operation or treatment, you kind of go, no, I did survive that. I did work my way through, and I did make sure that, I was positive going through that to make sure that I came out at the other side, as unscathed as you can be, which isn't a whole lot when you go down to it.
No.
But I think, what I'm trying to kind of get to, I suppose, is after all that, you've had that cancer diagnosis, and then you're sitting here now, what is it you feel that has changed the most for you personally in terms of your outlook? I know you said you've matured a bit, but what is it you feel has been your ultimate change after that cancer diagnosis?
I think I really appreciate the little things a lot more now. And I feel like every day is a bit more of a reason to be grateful. And yeah, I don't sweat the small stuff. I just look forward to building out, the rest of my life, really. And I can do that, not letting something like cancer be in the way. It can be alongside me, and I can use that to my advantage. But I just let myself live the life that I want to live. And I guess you can say that that's being a survivor. It's also just being yourself, because yes, cancer's part of you, but it doesn't define you in any way. And I'm just kind of grateful for the little things a lot more now.
Yeah.
And just enjoying the connections that I have, and the connections with myself too. I feel like I understand myself more now too. And I think that's something to be really grateful for.
Yeah. I think as well, when you're able to kind of have that introspective and outlook on yourself and go, right, wait a minute, this is who I am, this is what's made me me. I think that's such a great and empowering message to put out there. One of the things I was going to ask is that, obviously you've been through quite a physical toll with that. My body image went up and down in terms of, because again, I wasn't tied to my masculinity, but it was just did feel weird. But obviously you've got, a big scar here. How do you feel about that now? Like, again, you're still really young, and having quite a major surgery done. What's been your body image of yourself been like?
It was difficult just after the surgery because my hair was only just growing back. I'd lost a lot of weight, even from the surgery itself. I was in hospital for 4 days, and I couldn't really eat anything whilst everything recovered. So I'd lost weight from that. I was burning a lot of calories whilst just healing. Yeah. My surgeon said you burn about 4,000 calories a day just lying there whilst all the muscle and everything regenerates. So by the time I got home, I didn't even want to look at myself in the mirror because my belly button looked not how it looked before. My legs looked thin and not how I'd want to look. I had loads of bruises everywhere from all the kind of cannulas and blood tests they were doing. I had to inject myself with blood thinners, so I had bruises everywhere. And I'd never felt more undesirable, I guess, even to myself. So that was really tough. Over time, I've put the weight back on. I've gone to the gym, and I eat well. I don't drink alcohol anymore. And every time I see someone, they say, "Jonny, you look so well." And that really reinforces that's because I am well. And my scar now, I mean, it's healing, and I've not really posted it per se. I did have a photo shoot done recently to commemorate the scar. And once it's been 1 year exactly since I found my lump, I'm going to post those photos.
Yeah.
So I wear it now as a battle badge, I guess. But it was tough at the beginning, because although inevitably you will heal and you will get back to how you were, in that moment it feels nothing like that. It feels like you're going to look like this for the rest of your life. And I'd look in the mirror, and like I say, I'd be leaning like that. I wouldn't have the right posture. It would hurt to just lie on the other side of my bed. Even to go to the toilet would hurt, because everything's kind of been moved about in my tummy. I felt really vulnerable, especially in hospital as well, because I've never been in hospital before. So being a ward patient, having nurses have to like help you out of the bed, it felt like a foreign concept to me. I kind of had to learn to walk again, because I had a spinal injection done with this surgery. So they completely paralyze you from the waist down, which is good because it means you don't have the muscle memory of the surgery. Your body doesn't, but you have to like learn to engage your muscles again after that. Wow. So I look back at pictures of me just before the surgery, looking really nervous with my gown on, and the pictures afterwards. And yes, I feel relieved, but I knew that it was a longer road to recovery than the orchidectomy. And I guess I was still recovering from the chemo at the same time too. So it was like a double whammy of recovery. And so that took its toll on my body image. But I feel good about myself now. And I think being at the gym, investing in all the right things has helped me, and that will continue to help me too. Yeah,
because there's a lot of again, the conversations that we're having on here, there's so many different outcomes for people in terms of like some people's body image has been fine, but it's external as well. We've had guys on here talk about the fact that people have looked at them or they've talked about maybe having surgery, and people go, oh really, and it's it's a strange one, because in any other walk of life, any type of surgery, you wouldn't do that. And it's strange that it's that testicular stigma. And the minute you talk about balls, it's this thing. But where I struggled a little bit with my big scar. Yeah, I didn't care about the testicle not being there, but my scar being there, and it was so red and inflamed. But the fact that over the years that it's obviously died down, and you don't really see it as much, and again you kind of go, actually, it's proof that I've been through something. It's proof that I've survived something quite traumatic that nobody will really understand. And whenever, and I think that's the thing that connects us, especially as testicular cancer patients. I think that, whenever a group of us are together, Richie, who hasn't had testicular cancer, but he started the charity Cahonas, obviously, he always says there's this little bit of instant connection, that we guys like us who have had it, and he goes, you just suddenly start talking in a way that it's like soldiers who have maybe not been in the same battalion, but and I think there is that, and I think that's the community that we're trying to build and try and help, especially you say, I think there's times where we forget that the lower end of this is 15, and it doesn't mean that it stops there. And see, if you had said this to me when I was 15, I would have told you to go somewhere. But see, it's 15, you're still a child. You're 15, 16, even if you're 18, you're still so young and impressionable, and these things and this is a cancer that's affecting people with testicles at this crucial developmental age, and you look we had Chris Cree on, who talked about his experience of not only was he coming to terms with his sexuality, but then having testicular cancer. I can't imagine that. I just went through testicular cancer as a 30-year-old guy who was in a relationship, had a child, and things like that. So I think when you're 15 and that happens, that must be, I genuinely can't imagine what it is. And I think it's something that we really need to push more out there, is to, and as Cahonas, we are trying to do that, get into schools and educate in a way that's beneficial for young people with testicles, to really understand their body. And I think that's that's the kind of the big push for us, you know?
Definitely. I think there's so much out there. If we talk about the gay community, so I'm a gay man myself, and there's so much out there in the gay community about HIV awareness, for example, and sexual health. And it makes so much sense to bring testicular health under that too, because again, there's no national screening program for testicular cancer. There's no ultrasounds or anything like that. So the you know, being able to do the testicular examination awareness, and you know, and if the earlier you catch it, you know, you don't need to go through everything that I've gone through. I caught mine early too, but incidentally, most people can be cured by orchidectomy alone. And I think there's so much that we can do beyond charities like Cahonas doing everything good that they do in a community setting. You know, I think that there's lots to be done there too, and I think that can unite communities too.
Yeah,
so
definitely.
I think it's great, and I think also shining light on, you know, post-cancer treatment from a relationship perspective too, kind of managing people's expectations. You know, nothing really changes if you just have one testicle. These surgeries obviously can affect fertility, and chemotherapy can affect fertility. The RPLND is very close to nerve fibers that control ejaculation. So because the procedure itself isn't from a fertility perspective, it's from an oncology perspective, they will remove them if they can't distinguish them. So that carries risks too. So you have to counsel these people who are very young and make sure they're informed a lot about their treatment. And I mean, you mentioned Chris, and anyone else who's young, you know, they have to understand that these treatments, they will work, but you have to understand the effects that they could have on fertility and attitudes towards sexual relationships and everything like that. Because how else would you bring that up when you're dating or when you're kind of young and impressionable? So it's really important stuff to talk about.
Did you bank sperm as well? Like, did you get that opportunity to do that as well?
I did. I banked it 3 days before my orchidectomy.
Right.
They were like, quick, we need to get you seen at the clinic. So I went up to Hammersmith in London, and that happened. And then they said, you know, we'll have to call you back probably to provide a second sample. I was like, I'm not doing that. And luckily, they said it was fine.
Yeah.
But yeah, so I banked my sperm. Even if I hadn't done it by then, they would have offered it to me again before my RPLND because of the nerve fibers. So yeah, again, they need. I think there's more talk about that too, because I had no idea that even was part of the routine before an orchidectomy. So I did bank my sperm, luckily. Yeah,
because it's the questions that you get asked as well. And again, I was in a long-term relationship with my wife. You know, we had a son, but we still got asked the questions that, you know, and you know yourself, like, who do you want this to go to if you die?
Yeah,
you know, and you're going, I can't imagine being 25 or 15 in this happening. And again, it's such a topic that does need to be talked about when it comes to testicular health, especially within, you know, like the LGBTQI community. I think because one, when you're at those early stages of discovering your sexuality, like any young person is, you don't think about kids. And then if you then go on to have a same-sex relationship, you again aren't maybe necessarily thinking about kids. But if this happens to you, you know, you still want to have a way to then go, because, you know, there's so much out there for gay men and to be able to have children, you know, and that, I suppose that then, is that something that you, when you went through your surgery and had all your chemo, did you think about that for yourself? You know, the possibility of having children could wane because of that?
So when I was first told, you know, we're removing a testicle, we do sperm banking, I'd never thought about kids. At that time, I hadn't seriously considered it. So I guess I thought I'll do it because it's being offered to me. But I never thought, oh, well, I do want kids, so I have to do this. I just did it because it was an option.
Yeah.
And it was probably the most like pain-free part of the whole process. Yeah, and over time, I guess I have not thought about it loads, to be honest, because my priority was just me, and I didn't want to have to think, what about what about the future? What about the future generations? And I guess I also thought, well, if I do have kids from my sperm, there's a genetic risk there of testicular cancer. So I also thought, well, wouldn't I be burdening my offspring with a potential increased risk factor to have testicular cancer? And these things were going through my head more so than, oh, but I really want a family and I really want, to have 3 kids, for example, because I've never properly thought about it. So I was only thinking about it from a logical, like, genetics perspective.
Yeah.
So even now, I don't really think about having kids because, again, I'm still so young. I know I've got I've got sperm in the freezer in Hammersmith Hospital, but I guess it's still something I've still not fully thought about, I guess.
Yeah, but it's something, again, when, like I do everything, it brings it back to Cahonas, and it's something that as we're putting together, all these different kind of information packs and leaflets, like you say, there's different communities that can help within that. So, we try and go to as many kind of places where we can have the most reach to educate about testicular cancer awareness. But there is areas of reach where we have still to do, and that's not just within the LGBT community. That's with like your traveling people as well. People who don't have, if they don't have a fixed abode, how do they then get, they don't go to their doctors because they don't have, not a lot of GPs will take on travelling communities, so they have to have district nurses go out. So how do we interact with all these groups to kind of do that? And I think that's part of that. But having that conversation about fertility, and it doesn't matter, that, it's not just a straight man issue, fertility. No. I think that's the thing we have to try and get over. I think people who, I find myself online getting more and more frustrated when, you'll maybe see comments that are like, yeah, but it's only men that get testicular cancer. And I am by no means like a staunch anything, but it irks me in a way because I've actually met somebody who was a female who has testicles, and very lovely girl,
Yeah.
and I didn't understand. I still don't understand why, the language to use is dead easy. If you just try, and I flow in and out of maybe saying men, but then it's like if you can say people with testicles, it's not hard. To do.
When I've been posting about this, even on LinkedIn or something like that, I always say people with testicles because we're living in a world where people can be so expressive and be their authentic self. Inclusive language like that makes such a difference. And like I was saying at the beginning, losing the testicle just didn't affect my approach to masculinity because it's not defined by the genitals in my pants. It's just something that's there that serves a biological purpose, but not a gender or expressive purpose. So, inclusive language makes such a difference, and I think everyone's still got a long way to go with making sure that that's there. But you're right, it's again really important stuff to talk about. Yeah,
and it's important for us to kind of as a testicular cancer charity to really engage in those communities as well. And I think even going back to the language around it, it's when people say, yeah, it's only men that have testicles. Okay, but what about your testicular cancer patients who have lost both their testicles?
Yeah.
What are you saying about them?
Yeah.
And it then creates that negative feedback loop of, oh, well, even, our quote unquote men don't see me as a man anymore. And that's what we're trying to fight against is that stigma, embarrassment, that, it's talking about testicles. We're not talking about gender. We're talking about testicles. And I think testicular health for everybody, and even, when we go out and we do the talks, I always make sure to say that, because you'll sometimes have like mixed sessions, and you're like, the reason that everybody should be aware is because I could be feeling sore and not want to do anything about it, but you can go, I know the symptoms of that because I've been at this Cahonas session.
Yeah.
So
benefits everyone.
It benefits. It's a bit like, if you got breast cancer awareness or even menopause awareness, a lot of companies are making sure that, especially older generations, it's like, listen, she's not crabbit.
Yeah.
There's a hormone thing going on that you have to be aware of. And I think that's the same for us. And I think especially you and I who have got one testicle where, you know, thankfully, you know, our testosterone is starting to level out, but there is still elements of that fluctuation that can happen for us. And
yeah, I think health awareness and health mindfulness goes such a long way, and beyond just testicular health. But you mentioned menopause, breast care. It's such an investment. Health is wealth as well. So all those sayings, like it goes such a long way.
Yeah, and tying in obviously not just physical health, but the mental health aspect of it as well. Before we kind of round up as such, I was just going to ask as well. You know, you've talked about, you know, therapy. Were you kind of involved in therapy before your diagnosis, or was that just kind of been through this?
It was offered specifically as a cancer psychological therapy. So I had counselling offered through Macmillan Cancer Support, and I had 12 sessions of that. And even if I hadn't had cancer, that would have still done the world of good, you know. And I'm very grateful that was there for me. And I'd encourage kind of everyone who's health mindful, I guess, to use that word, that it's so beneficial, and it does a lot more benefit than kind of, you know, the odd coping mechanism that a lot of people my age would lean towards.
Yeah.
So that was a real benefit to me, and I'm really grateful that I was able to have that just after my chemotherapy ended. Yeah.
And there's so many good charities out there that do work, and that's something that we're trying to move into as well, is trying to kind of do that support. But there is so many talking charities, there is so many ways. You don't have to. Unfortunately, in Scotland, the NHS waiting list for psychological therapies is 2 years.
Right.
But there's so many groups out there. There's so many guys who are now realising that it's, you know, to quote, you know, Andy's Man Club, it's okay to talk.
Yeah.
You know? And I think that's the thing. You know, we do have to talk as just as humans, you know, about our struggles. And if that's in a small group, and if that's just sitting having a coffee and, you know, not necessarily talking about it, but talking about it, that's an okay thing to do.
Yeah, definitely.
If you were to kind of look back in this past year, and is there anything that you'd want to say to yourself pre or post orchidectomy, now that you wish you had known then, or that would help listeners and watchers of this? What advice or what support would you offer?
I would say just stay mindful, I guess, and be aware of kind of what could be ahead, and don't get lulled into a false sense of security, I guess, because, you know, for me, I guess it was left a month until they did test my blood again, and it was a cause for concern. So I guess, be mindful, be reflective in general, and I think that's all I can really think to say, because I'm still learning a lot about it all anyway, and I guess as the years go on and it unfolds, I'll learn more about that, and maybe in a year's time, if someone asks me that, I'll have a completely different answer. But I guess support yourself, and if you know, have your friends support you too, have everyone make use of all the support that's available to you. But it's a continuous kind of learning journey.
Yeah, brilliant. Jonny, thank you so much for coming on Check 1 2. Honestly, it's been great. I think we probably could talk more, so let's book in another one.
Yeah, that'd be my pleasure. Thank you so much.